If you're about to have prostate surgery or you've recently had it, you're probably wondering one thing: how long is this recovery actually going to take? Maybe you've heard someone say they were back to normal in 6 weeks, while another person says it took them over a year. So who's right? Well, both can be. Recovery after a radical prostatectomy isn't a straight line and it doesn't happen overnight. But knowing what to expect at each stage can make the recovery much less stressful. In this video, I'll walk you through exactly what to expect at each stage, from the first week after surgery all the way through to 12 months, covering urinary control, energy levels, exercise, erectile rehabilitation, and what to realistically expect in each stage. Let's get started. Hi, I'm Bradley. I'm a physiotherapist specialising in men's health and prostatectomy rehabilitation. I help men recover after prostate cancer so that they can regain confidence, improve their bladder control, restore their sexual function, return to exercise, and get back to doing the things they enjoy. Before we begin, remember that every recovery is different. Your age, general health, level of fitness before surgery, whether nerves were spared, and whether there were any complications during surgery all influence your recovery. What I'm sharing today is a general guide rather than an exact timeline. Always follow the advice of your surgeon or treating team, particularly when it comes to medications and penile rehabilitation. The first week is all about healing. During this stage, you'll usually have a urinary catheter in place. Most men are surprised by just how tired they feel. Even though many prostatectomies are now performed using minimally invasive techniques, it's still a major surgery, and your body is put under an immense amount of stress, and it requires a lot of energy for healing. Walking is one of the best things you can do during this time. You don't need to be chasing step counts or trying to push through. Instead, aim for short, regular walks around the house or outside if you're comfortable. Movement helps reduce stiffness, improve circulation, reduces the risk of blood clots, and just makes you feel more like yourself again. It's also important to stay hydrated, eat enough protein, manage constipation, and avoid any heavy lifting while your body heals. At this stage, your focus should simply be on healing. Most men won't begin erectile rehabilitation until once the catheter is removed and they've been reviewed by their surgeon. Between days 10 and 14 is when the catheter usually comes out. And surprisingly, this can be the most challenging part of your rehabilitation. Many men notice urinary leakage once the catheter is removed, and this is completely normal. Your pelvic floor muscles now have to take over the job of controlling urine again. Some men only leak with coughing or standing up, while others need several pads throughout the day. Neither automatically means something is wrong. This stage is where pelvic floor exercises become particularly important. Consistency matters more than trying to do hundreds of repetitions. Alongside your exercises, continue gradually increasing your walking. Depending on your surgeon's protocol, you may be prescribed a medication such as Viagra, Cialis, or another PDE5 inhibitor within the first few weeks after your surgery. It's important to understand that these medications aren't always prescribed with the intention that you'll be able to achieve an erection suitable for intercourse. Instead, they're often used to improve blood flow to the penile tissue and support long-term recovery of erectile function. Many men are also advised to use a vacuum erection device or penile pump during this period. Again, the goal isn't necessarily sexual activity straight away. Regular use of a penile pump may help to maintain penile tissue health and encourage healthy blood flow while the nerves recover. One mistake I commonly see is trying to get back into the gym too early. Remember, the external wounds may look healed, but the tissues inside your body are still healing. Healing continues long after the skin has closed. From week 6 to 12, many men start feeling much more like themselves. Energy levels improve, walking becomes easier, and many people return back to work during this period, depending on the physical demands of their job. This is also when you can usually begin progressing your exercise program, provided you've been cleared by your treating team. Strength training becomes increasingly important. Losing muscle after surgery is common, particularly if you've had androgen deprivation therapy alongside your cancer treatment. Resistance training can help rebuild strength, improve function, increase your confidence, and rebuild bone strength health. Some men recover continence quickly. For others, progress takes some time. Both experiences can be completely normal. Many couples also ask when it's safe to resume sexual activity. In most cases, intercourse can be resumed once your surgical wounds have healed, the catheter has been removed, and your surgeon has given you the all clear, which is usually around about the 6 weeks post-surgery. It's important to remember that being medically cleared for intercourse doesn't necessarily mean that erections have returned. Many men require medications, a vacuum device, injections, or other treatments during this stage, and that's completely normal. Intimacy doesn't have to wait for perfect erections. Maintaining closeness with your partner is really important in your recovery. From months 3 to 12 and onwards, this is where many of the biggest improvements occur. Bladder control continues improving, confidence increases, and exercise capacity returns. Many men resume golf, running, cycling, gym training, and other activities they enjoy. Sexual function also continues improving during this period. It's important to remember that erectile function often recovers much more slowly than bladder control. For some men, improvement may continue for up to 2 years after surgery, particularly if both nerves were spared. This is why ongoing penile rehabilitation is so important. Continuing with your prescribed medication, vacuum pump program, pelvic floor exercises, and any other treatments recommended by your healthcare team is really important during this stage. So recovery doesn't stop after 6 weeks. In actual fact, that's really just the beginning. The biggest mistake I see isn't exercising too little. It's comparing your recovery to someone else's. You might read online that someone stopped leaking after 2 weeks, while another says it took them 12 months. One man may regain their erections within a few months, while for others, it may take up to a year. Neither timeline predicts yours. Focus on your own progress, celebrate small improvements. Recovery is measured over months, not days. If there's one message I want you to take away from this video, it's this. Recovery after prostate surgery is a marathon, not a sprint. There will be good days, but there will be frustrating days. With the right rehabilitation, patience, and guidance, most men continue making meaningful improvements months after surgery. If you're preparing for surgery or you're already recovering and you'd like evidence-based advice, consider subscribing to my channel for more videos like this each week. Thanks for watching, and I'll see you in the next video.